Okay, guys, the topic that we will be dealing with now will be the arteries of the upper limb. So, first we'll start with the subclavian artery. It is divided into three by a muscle, that is the scalenus anterior muscle. There's an easy acronym that is vitamin DC. The first part is into vertebral artery, internal thoracic artery, and thyrocervical trunk, which is divided into suprascapular artery, inferior thyroid artery, and transverse cervical artery. And now to the second part, which is this costocervical trunk. Costocervical trunk gives rise to two parts, superior intercostal artery and deep cervical artery. And then the third part, the dorsal scapular artery. And now we move on to the axillary artery. Extend is from continuation of subclavian artery at the outer border of the first rib and continues as the brachial artery in the lower border of teres major. There are three parts and branches. The axillary artery divided into three parts by the pectoralis major muscle. And there are three parts. The first part lies proximal to pectoralis minor muscle, second part lies deep to the pectoralis major muscle, and the third part lies distal to the muscle. And now the branches of the axillary artery. There is an easy acronym, that is SAL-SAP. First part gives one branch, superior thoracic artery. Second branch gives two branches, acromiothoracic artery and lateral thoracic artery. And the third part gives three branches, the subscapular artery, anterior circumflex humeral artery, and the posterior circumflex humeral artery. And now we move on with the applied of axillary artery. Arterial anastomosis around scapula formed by between the branches of first part of subclavian artery and branches of third part of axillary artery. And now we move on to the brachial artery. It is a chief artery of the arm. Extent is continuation of axillary artery at the lower border of teres major to the termination as radial and ulnar artery at the neck of radius within the cubital fossa. The first branch will be profundo brachii artery, the largest branch of brachial artery. Runs backwards and accompanies the radial nerve in the radial groove or spiral groove in the lower triangular space. Divides into anterior and posterior descending branches. And next will be the nutrient artery to the humerus, the muscular branches, superior and inferior ulnar collateral arteries, and two terminal branches, the radial and ulnar artery. Now we move on to the relations. In the upper arm, the brachial artery lies medial to the median nerve, and in the lower middle arm, brachial artery crosses the median nerve, and in the lower arm, it lies lateral to the median nerve. And for the applied, brachial artery pulsations can be felt in the cubital fossa, and the brachial artery compressed against the humerus to erase bleeding in case of emergencies. And now to the palmar arches. The superficial palmar arch and deep palmar arch. First one we'll go with the superficial palmar arch. Formation is from the main contribution of ulnar artery and superior palmar branch of radial artery, and the location will be lies deep to the palmar arch and superficial to the flexor tendons, the flexor digitorum superficialis and flexor digitorum profundus tendon, and branches are one proper palmar digital artery and three common palmar digital arteries. And now we go to the deep palmar arch. Formation is from the main continuation of radial artery plus the deep branch of ulnar artery. Location lies deep to the flexor tendons, flexor digitorum superficialis and flexor digitorum profundus, and lies superficial to the metacarpal bones. Branches are palmar metacarpal artery and perforating arteries. You can easily draw the hand and just draw two arches with its branches and the radial artery and ulnar artery, with which you can easily complete the diagram this way. You can clearly see that the deep branch lies proximal more than the superficial arch by 1 to 2 centimeter. And that's easy anatomy for you, and thank you for watching. Please like and subscribe if you like the video.